Ebola virus disease is one of the world's most serious hemorrhagic fevers. Outbreaks cause fear, but misinformation can spread faster than the virus itself and can be just as deadly. When communities distrust health workers, avoid treatment centers, or resist contact tracing, outbreaks grow. Clear, accurate facts reduce fear and dramatically improve outbreak control. In this video, we examine 6 dangerous myths about Ebola and the WHO-verified facts that save lives. Myth 1: Everyone with Ebola bleeds. This is false. Bleeding may occur, but many patients do not bleed at all. The earliest symptoms of Ebola are nonspecific and easily confused with other illnesses. They include sudden fever, severe fatigue and weakness, muscle pain, headache, sore throat, followed by vomiting, diarrhea, and abdominal pain. Bleeding and other hemorrhagic signs, if they occur, appear much later in the illness. Recognizing these early, nonspecific symptoms is critical because seeking care quickly is the single most important thing a patient can do to survive. Myth 2: People spread Ebola before their symptoms begin. This is false. A person infected with Ebola virus is not infectious to others until symptoms appear. This is because virus levels in the body are very low during the incubation period, which lasts between 2 and 21 days after exposure. This fundamental biological fact means that contact tracing is highly effective. Contacts of confirmed cases can be safely identified and monitored without risk during their symptom-free period. If they do develop symptoms, they can be rapidly isolated, breaking the chain of transmission before it can spread further. Myth 3: Ebola spreads through the air like influenza, measles, or COVID-19. This is false. Ebola is not an airborne disease. It does not spread through respiratory droplets in the way that influenza or COVID-19 can. Ebola spreads through direct contact with the blood, secretions, organs, or other body fluids of an infected person, or through surfaces and materials that have been contaminated with these fluids. This is why standard barrier precautions including gloves, gowns, face shields, and hand hygiene are effective at stopping transmission. Healthcare workers who follow proper personal protective equipment protocols are protected. Myth 4: Mosquitoes or other insects can spread Ebola. This is false. There is no scientific evidence that mosquitoes, flies, or any other insects can transmit Ebola virus. Ebola is not a vector-borne disease. Unlike malaria, dengue, or Zika, it does not travel through insect bites. The natural reservoir of Ebola virus is believed to be fruit bats of the 𝗙𝗯𝗏𝗍 family. Humans can become infected through contact with the blood or secretions of infected animals, or through handling infected wildlife or bushmeat. From there, it spreads person to person through direct contact with body fluids, not through insects. Myth 5: Ebola always kills. This is false, and this myth is particularly dangerous because it causes people to avoid seeking care. Ebola is severe and often fatal, but survival is absolutely possible. Case fatality rates have varied widely across outbreaks, from around 25% to as high as 90%, depending primarily on the quality and speed of care provided. The 2014 to 2016 West Africa outbreak saw survival rates improve significantly as supportive care was standardized. Patients who received early rehydration, nutritional support, and management of symptoms had dramatically better outcomes. With modern monoclonal antibody therapeutics, survival rates have improved further. Seek care. It saves lives. Myth 6: All Ebola vaccines and treatments work for every type of Ebola virus. This is false. Licensed vaccines, including 𝗏𝗡𝗏𝗏𝗏, known by the trade name 𝗙𝗏𝑒, and the 𝗏26' regimen, as well as approved monoclonal antibody therapeutics such as 𝗏𝑚𝑎𝑍𝑒 and 𝗏𝑖𝑏𝑎𝑛𝑔, have been specifically developed and tested against Zaire Ebola virus, the species responsible for most major outbreaks, including the 2014 West Africa epidemic and the 2018-2020 DRC outbreak. 4 other members of the Ebola virus genus, including Sudan virus, 𝗏𝗶𝘀𝗽𝗶𝘀𝗃 virus, and Thai forest virus, there are currently no approved vaccines or therapeutic treatments. This means that correctly identifying which Ebola species is causing an outbreak is a critical first step in determining which medical countermeasures can be deployed. Ebola is controlled through 6 proven public health strategies. First, early care. Patients who seek treatment quickly have far better outcomes. Second, safe isolation. Infected individuals must be separated to prevent spread to families and healthcare workers. Third, contact tracing. All people who may have been exposed must be identified, monitored for 21 days, and supported. Fourth, infection prevention and control. Rigorous use of personal protective equipment, hand hygiene, and decontamination protects everyone. Fifth, safe and dignified burials. Ebola victims remain infectious after death, and trained burial teams prevent transmission while respecting communities and families. Sixth, trust. Community engagement and trust in health authorities is not optional, it is the foundation on which all other measures depend. Misinformation costs lives. Facts save lives. The 6 myths we have examined today are dangerous precisely because they discourage people from seeking care, cooperating with contact tracers, or trusting health authorities. When communities have accurate information, outbreaks are contained faster, fewer people die, and recovery is faster. If you or someone near you experiences sudden fever, severe fatigue, or other early Ebola symptoms in an affected area, seek care immediately. Trust your health workers. Follow public health guidance. Share verified information from the World Health Organization. Together, through early care, safe isolation, contact tracing, infection prevention, safe burials, and trust, we can stop Ebola.